Now, the KeReady mobile health clinics come about when there was when there was a need to close the vaccination gap among young people in rural Eastern Cape. Now, the campaign has somewhat been extended and become a movement dedicated to improving access to health care, especially among young people across the country. Let's speak a bit more about this initiative and bring in our guest, Dr. James Menyah-Artivor, who is a KeReady Youth Doctor with us in our studios here in Johannesburg. And Dr. James, it's lovely to have you with us. Thank you so much indeed for coming through. I wanted to start by taking a couple steps back. Let's speak a bit more about this initiative, its inception, and what necessitated that.
So, you rightfully said it started really in the peak of the COVID-19 pandemic, where young people, or the age group 12 to 34, was the lowest vaccinated group. And we also realized that it wasn't because, or the hesitancy was rather informed by young people that were curious about the vaccine. They wanted to know more about the side effects, what does it actually do, what is in the vaccine. And us as young doctors were brought together to sort of convey that message and give the facts so young people can make an informed decision and then opt to get vaccinated or not based on the facts. What we also then, what was positive from the birth of that initiative is that within the first 2 weeks, we saw that there was an increase of about 250,000 young people that were vaccinated just because of that young person to young person messaging. So today, it's moved more away from the vaccinations. Because of that need of information, we broadened our horizons to say that we now do primary health care as well. And our health information is based on giving young people the facts about general health care, healthy lifestyle, substance abuse, all the things that really are affecting young people's daily lives. And in a nutshell, that's what hashtag KeReady is about for the youth.
All right. And it's very interesting because we never really, well, at least not in the line of work that I've been involved in, speak about specifically youth-centered health care. And it's a group of people which I think are not homogenous, but also have their own ideas about their bodies, right? Young people are usually, very passionate about body positivity, it's the idea of sexual liberation, bodily autonomy, etc., etc. How does that complicate your ability to at least engage with them where they're at, if you know what I mean?
So it's a very good point that you're bringing. Because we are young people as well, it doesn't complicate it at all because we understand each other. We speak the same language. And really for us, it's really meeting the young people where they are at, as you said. And with our sort of movement, we engage with young people on social media platforms. We're really big on that. And we get such a good feedback from young people. They engage with us as well. But on social media, we give them sort of curated health topics that the doctors will make videos on. We'll answer questions. We've got a WhatsApp chatbot where you can ask a doctor a question, any medical-related question, unfiltered, non-judgmental, no jargon.
And that's important, right? I was about to ask you, do you feel that sometimes young people are much more open with younger doctors? And I'm trying to think if I were to find myself in a consultation room, whether I'd go all the way merely by feeling like this person can relate to me. And I suppose that's where the sweet spot is, right?
Definitely. So I think, even from experience, I've seen that when you're talking to a young person, or when a young person comes to consult a doctor, let's say if you're comparing it to an older doctor, you get sort of a top-down approach. The doctor is telling you what to do. You have to do this to get better. And a lot of the time, there's no time for explaining or asking questions. And young people are very inquisitive. They would like to know, how does this work? Why does it work? And I feel a young person will be more comfortable asking another young person this, because we also know that from historically, young people clinic or hospital experiences are not that pleasant in a young person's body. Like you're getting instructions. It's not a discussion. And when you speak to a young person, someone that you feel might understand you better, it's a lot more easier to get sort of that information that you're looking for, or even that just that little bit of motivation to carry out your health needs.
Yeah, and I wonder how helpful that is for you as doctors, right? Because a lot of what you might have studied over, what is it, 6 years, 7 years or so?
6 years,
of your degree is information that's been gathered over the years, and let's face it, it wasn't put together by young people, right? And today, you, at least through this initiative, are having to engage with the contemporary issues that young people face. Are you finding that there is an alignment, or if you had things your way, you could even make adjustments to what's being taught in universities so that it appeals more to young people?
Well, I think for us, it's really taking that information that we've learned over the years, because the facts are the facts. We can't really change the human body. What we've been taught is really what happens. But for us, it's more important that we have that information and we're able to sort of package it in a way that we can distribute it to young people in the sort of informal or rural areas that don't really understand the medical talk. And we can explain it in a much simpler way that will sort of inform their decisions much better.
Yeah. And, you know, it's a good thing that you mentioned this idea that it's in rural areas in some ways, that's where this initiative started. I wonder whether you reckon, because young people in rural and urban areas live such different lives, that they're at different health risks? Or are you finding generally young people make the same mistakes, have the same blind spots, and therefore fall into the same pitfalls?
It is generally, I think the real sort of fundamental issue is that you don't have the information. I think when you see someone in a more urban area, they have better access. Even if they need to go to see a doctor or they have a medical complaint, it's easier for them to get there. But someone in a more informal settlement, rather, they don't have that same luxury. So I think that's really where the difference comes about. In terms of the health issues or the behaviors, I think those are pretty much the same.
Right. And I suppose, as a way of rounding up our discussion, there'll be questions around where the gaps actually lie. You know, you've had time to discuss these issues with young people, even during the COVID-19 pandemic, and I'm sure you've been able to gather some kind of data about where the focus actually should be if we are to get young people to where they need to be health-wise.
I really think that it's the information. Information is so key when it comes to health issues. And what, like I did mention, we have all this information on our social medias. At KeReady SA is the handle. And then our WhatsApp bot where we answer the questions is 060-019-0000. And this, I have found, has really empowered young people, especially on the ground where we are. We get so many different questions, a wide variety.
Like what? Take us through perhaps some of the ones that come to mind right now.
Well, it's interesting because a lot of the questions are actually based around sexual and reproductive health.
Right.
And a lot of pregnancy questions, STI questions. Is this going to affect my ability to fall pregnant, or even the other way around? How can I stop getting pregnant? And just as an example, there are people who believe that drinking castor oil or mixing something with Coke can help you terminate a pregnancy, which is absolutely incorrect. And then we are there to tell these people, okay, no, this is not going to help you. Rather do this. There are places you can visit. You can do HIV tests. You can different things that we actually tell them that will better inform them. There's contraceptives out there. If you miss your chance, there's emergency contraceptives. you can use PrEP to prevent the infection of HIV. There's such a lot that we deal with on these WhatsApp lines, and I think it makes a big difference because in the end, or at the end of that discussion or conversation online, we really get the sense that this person has come with an issue and we've solved it. We get that thank you message. This is really helpful.
Right.
And yeah.
Sure. As you say that, in the past we speak to some of your older colleagues, let's call them that, the wiser doctors, as they say. And many of them have raised concerns around the gender divide around people who actually seek medical advice, right? Typically, women are more likely to come forward and ask for medical advice. They take care of themselves, they listen to their bodies, whilst men aren't that good. Do you find the trend being consistent among a younger population, that it's mostly younger women who essentially come forward to ask questions about even sexual reproduction, etc.?
Yes, it is. I think it is. The trend is pretty much the same. But also what we are finding is that with our movement, so we've got these 46 mobile clinics that rove around in 4 provinces. We've got Gauteng, Western Cape, Eastern Cape, and KZN. And on the ground, we are sort of visible. You see us when we drive through. It's this purple mobile clinic. The gazebos are strategically placed, and everyone can see. And we also have noticed that maybe in the beginning it was a lot more the women or the young females that visited us. But over the time, the men have actually been coming as well. And I'm not sure why that is, but we like to think that it's because our staff is also quite young. We are approachable. There's a vibe. If you happen to visit us on the ground, we've got loud hailing. There is music, free Wi-Fi at the on-site. And that really attracts people that don't usually have this kind of access. And then on the side, they are able to get a free HIV test, free screening for high blood pressure, diabetes, STIs, TB. We have immunizations for the little ones, vaccinations for the younger one, the older generation if they happen to come as well. And it's really a complete package. Yeah.
Absolutely. And its work whose importance cannot be overstated. Thank you so much indeed for coming to explain all of that for us. Hopefully be able to yield better than your desired results, given what's at stake. Really appreciate your time.
Thank you.